Hello, my name is Josie and I'm going to be talking to you about pain relief options for moderate to severe pain. Within the pain relief options for mild to moderate pain section, the idea of starting on the analgesia ladder or starting off with milder forms of pain relief and progressing if needed was introduced, along with some of the available pain relief options to help you manage your pain or discomfort. However, if the pain gets more severe or you are unable to cope with the pain despite using the milder options, the following alternatives may be of interest to you. It is important to note that certain methods of this pain relief are only available in certain locations for your labour and birth. Diamorphine is generally used when your labour is established and the pain is more intense. It's an opiate drug which relaxes the body and reduces your pain. It's given through an injection into your thigh, so it enters your bloodstream and disrupts the pain pathways in order to reduce your pain. It can have some side effects including drowsiness, nausea and euphoria, which is an intense state of happiness or excitement. It can affect your breathing sometimes by slowing it down or making your breathing shallower, and can also affect the baby if they are born soon after the diamorphine is given, making the baby drowsy at birth. The midwife will be noting your breathing patterns and checking the baby when it's born, and will take things like pain relief methods into account. Remifentanil is very similar to diamorphine, but rather than being an injection, it's given continuously through a drip and a cannula, which is a small plastic tube which has been placed into a vein, usually in your hand. It is a patient-controlled medication. This means that it enters the body very quickly and wears off very quickly, so you have a special button that you press so that the pain relief occurs with your contractions. It has the same side effects as diamorphine, drowsiness, nausea and euphoria, and it can also affect your breathing, as your breathing becomes slower and shallower in the short term. But this can be corrected if there's a concern, and you may have oxygen administered at this point. An epidural refers to a mixture of opiate drug and local anaesthetic, given through a small plastic tube which has been inserted into the epidural space next to your lower spine. Epidural will affect the nerves that run out of your spinal column, and the aim is to make you completely numb around your abdomen and legs, so if you want to be mobile during your labour, this might not be the option for you. When working correctly, epidural is an effective form of pain relief, but it can lead to longer labours, increased risk of forceps or ventouse, which is a suction cup delivery, and is associated with some more serious but rare risks which your doctor and midwife will discuss with you if this is an option that you are interested in. You will need to be in a consultant obstetric labour ward in order to have an epidural. They're not available at home or in a midwifery-led birth centre.